Welcome to the second episode of Treat in Oman, a podcast where we bring you expert voices from Aster Al Raffah Hospital to help you better understand health, wellness and care right here in Oman. Today we'll be talking about one of the most important journeys for a parent, that is caring for your newborn and children. And joining us at the TAS studio today, we have two doctors from Aster Al Raffah Hospital, Dr. Dina Fekry and Dr. Hazer Qasem, both of whom are specialists in neonatology and pediatrics. Doctors, thank you so much for joining us today.
Thank you. I'm so happy to be here in your studio. I'm Dr. Hazer Qasem, specialist in neonatal and pediatric in Royal Aster Al Raffah Hospital. I joined them since 2 years. I am from Syria.
Thank you very much. I'm so glad to be here today. I'm Dr. Dina Fekry, specialist pediatrician and neonatologist at Aster Al Hospital. I joined them 2 years now. I'm from Egypt, and I'm so happy to be with you today.
Dr. Hazer, let's begin with the first few days of bringing the newborn baby home. What are the most important things that parents should know?
We should focus on to keep baby warm, feeding, focus on the bonding, keep the mother very close to keep the baby close to the mother. And if any warning signs, any difficulty breathing, any yellowish color, we should that time encourage them to contact with them pediatrician.
Now, breastfeeding is one of the biggest concerns for new mothers. How would you guide them to start and maintain successful breastfeeding?
First of all, Aster Al Raffah Hospital, it's a breastfeeding friend hospital. We encourage all mothers to give breast milk. We start our work from delivery room or OT room as pediatrician. We encourage to make skin to skin, to give the position and put the baby for latching since birth. And we encourage to give feeding every 2 to 3 hours, especially first 2 weeks. And we always give the mother simple message that don't worry, your milk will increase by the time when you give feeding more, the milk will increase more.
Dr. Hazer, let's move on to warning signs. Parents often worry about missing on warning signs. What do you think are some of the red flags in newborn babies that parents shouldn't ignore?
Most important things, if the baby has any fever, any difficulty breathing, any difficulty feeding or less eating than usual, yellowish color or lethargic or less active, and if the baby vomiting a lot, that time you should contact with your pediatrician directly.
Now, of course, routine is everything, especially for a newborn. How do you guide new mothers in their newborn sleep, feeding, and day-to-day care?
We teach mother the safe sleep practice and feeding schedule, diaper care, and bathing tips. We try to encourage them to do everything without any stress, with confidence.
Dr. Hazer, as a pediatrician yourself, how do you emotionally and physically support new mothers after they've given birth?
Always I should remind each mother that she will pass in very difficult time after delivery. I reassure her that all the challenge she will face it will be normal, and we try to listen to her, to encourage her, to answer all her questions. I think the emotional support is very important, same medical support in general. Yeah, that's it.
What role do parents and families play in shaping the baby's early development?
From first day of life, I encourage them to hold the baby, talk with baby, to play with him, and any small interaction will make big difference in the baby life and his growth.
Now, this brings me to my last question. The whole process of, pregnancy and giving birth to a new child, bringing the baby home, it's for some women and for the moms and dads, men and women, it can be a scary experience, although a beautiful one. What advice do you have for new mothers to feel confident and empowered in caring for their babies?
The message I will give for each mother she will deliver, trust yourself, love your baby, and ask for help anytime from your family, from your doctors. And the love and care, more important than any thing, to do it for your baby perfectly. Thank you.
Thank you, Doctor. Now, Dr. Dina, I want to take this a step further. Not every baby gets to go home right away. Some of them need special attention at the NICU. So for those of us who don't know what that means, can you tell us what the NICU is and why is it important for a newborn?
Okay, the NICU, which stands for the Neonatal Intensive Care Unit, it's a special unit in our hospital that we can take care of newborn babies, especially babies that have medical illnesses or premature preterm babies. And inside the NICU, they will have the proper support, the technology we need for maintaining their normal growth and development. And then we can take care of all newborns until they are safely discharged from the hospital with their mothers.
Okay. You did mention preterm babies. Can you explain what preterm babies are and why do they require special attention?
Preterm means that the baby delivered before its time. And in medical term, it means that the baby delivered before 37 weeks of pregnancy. And this means that his functions, organs are less mature.
Okay.
In this box, the baby in certain struggles, like with breathing, feeding, maintaining body temperature, fighting infections, and this makes us in the role of taking care of them until they can reach to the level they can withstand everything by their own without any help. This is what we do in NICU.
Okay. Now at Aster Royal Hospital, what kind of care is given at the NICU to preterm babies?
Each baby, preterm especially, are unique. Each one have a special need. So we just do like tailored management plan for each baby individually according to his needs. Inside our NICU, we provide all care needs from the special environments, the incubator that we can admit the baby to be safe and with optimum body temperature, taking care of the baby all the time. And if need any support like oxygen support, from normal oxygen support even to mechanical ventilation, and also giving some medication if the baby is fighting infections. We are providing nutrition, especially for preterm babies. They will not be able to take the nutrition like oral, by normal like other babies. They will have to start with parental nutrition or intravenous nutrition until we reach the point the baby can take intra, first with tube method, and then we start the oral and breastfeeding and so on.
Understood.
And also the baby need developmental care. We can offer also the skin-to-skin care, the kangaroo care, and in this part especially the parents are involved.
Okay. So this entire process, I mean, for a parent, it must be extremely emotionally challenging, you know. It's a very scary ordeal that a parent has to face. How does your team at Aster Royal Hospital support parents during this time?
In the NICU, we usually involve the parents. We consider them as partners in the care of the baby.
Yeah.
So we encourage them to take care of the baby, touching, talking to the baby, skin-to-skin contact and kangaroo. And all that care, we just provide guidance and emotional support for them so they can be more confident and seen involved. And in some time, they would be ready to receive the baby and take care at home.
Dr. Dina, at Aster Royal Hospital's NICU, are there any success stories at the NICU that stand out for you?
Absolutely. So many newborns admitted under our care with different medical illnesses, premature and low birth weight babies, and they grow up normally to be healthy children. And this gives us, and parents also, the message that for every NICU struggle, it can be turned out into a success story.
And lastly, Dr. Dina, what message of hope do you have for parents who currently have newborns at the NICU?
I would tell them, hold on to hope, and your tiny little baby is strong enough. They are stronger than you can even imagine. And every tiny step forward is a triumph with love and care and proper handling their baby. They will be stronger, getting more stronger and better every day.
Thank you so much. That's very encouraging to hear, Dr. Dina. Thank you.